Hi, let's talk about acute chest syndrome. What is acute chest syndrome? Acute chest syndrome is a crazy level of sickle cell crisis. It is so crazy that they can't breathe no matter how hard they try. They're coughing, they're having difficulty breathing, and they're having pains in the upper region. Some of them also have pains in other parts of their body, in addition to having pains in the upper part. But some of them only have pains in the upper part, which is the chest region. And some of these complications that can arise from acute chest syndrome include pulmonary fibrosis. What is pulmonary fibrosis? It's a situation where, because the body is not getting oxygenated blood, then the lungs start scarring. When the lungs start scarring, then parts of the lungs can even die off. So it is so crazy that no matter how hard they try to breathe, the oxygen is not even going in. So that leads to other kinds of complications like pulmonary hypertension, pulmonary fibrosis. We're talking about multiple organ failure, and then there's also the issue with the spleen because the blood level is going to drop in such a way that the level of blood in the whole body is so low that means they're super anemic and they need immediate transfusion. We're also talking about cognitive recognition. Sometimes it affects the brain because there's not enough oxygen going to the brain, so they can lose recognition of where they are and have some other brain issues, which is crazy because of acute chest syndrome. And some other things I can't really remember right now that comes with acute chest syndrome can be respiratory. I know we've already talked about respiratory failure, but some of the ways to treat it is to place the patient on oxygen, place the patient on antibiotics. It could be fungal, it could be bacterial kind of infection. And then you're also transfusing the patient as soon as possible because this kind of crisis leads to instant death most of the time. So you need to get on it as soon as possible.